welcome to the Clinical Pharmacology and Drug Therapy channel. Today we are going to continue our discussion about antibiotic, and we are going to explain the macrolide. Okay, this slide here explains the mechanism of action of macrolide. Macrolide is a group of antibiotic that inhibit protein synthesis, bacterial protein synthesis by binding to the 50S ribosome subunit. Here we need to remember that if you go back with your previous lecture, we discussed tetracycline with you, then we discussed the aminoglycoside and aminoglycoside. Both of them work on the 30S subunit. So let me clean it, make it clear, and both of them inhibit protein by binding to the 30S subunit. So on the other hand, macrolide bind to the 50S subunit ribosome, and this will prevent translocation of the RNA and inhibit growth of the bacteria. Macrolide in general considered bacteriostatic, but with the higher concentration, macrolide become bactericidal. Okay, as you can see here, this is a normal process for the ribosome. We have 50S subunit, then we have 30S subunit. We have the ribosome here try to transfer the location between the two ribosome here, and our medication erythromycin and clindamycin, chloramphenicol, 3 medication inhibit translocation of the ribosome, and you can see here inhibit moving this ribosome from one side to another, and we have only one medication left. So what happened here, we need to remember that if you go back there, so the result will be prevent translocation of ribosome on 50S subunit. Clinical use of macrolide, I will go briefly for each medication. Erythromycin, effectively considered like effective medication against organism that target by penicillin G, and especially when the patient suffer from allergy to the penicillin. So the alternative option will be erythromycin. So all the organism will be treated with the penicillin G could be used to treat with the erythromycin. So if you have a history of patients, if you have patient has a history of allergic to the penicillin G, and the alternative will be erythromycin. So this is a case study here. The patient come to the clinic during your taking the drug history. The patient mentioned that he has a history of severe allergic reaction towards the penicillin, and you are going to prescribe erythromycin to treat the infection. So erythromycin will be the drug of choice. Important issue. This is fact number 1. Fact number 2 about the erythromycin. Erythromycin inhibit metabolism. So please remember here, it's very important when you say inhibit metabolism, this give a chance for drug-drug interaction to inhibit metabolism of several medication. Let me say we are talking about warfarin, for example. If the warfarin, if this medication inhibit metabolism of warfarin, this will increase concentration of warfarin, and this will lead to the increased risk of bleeding, for example. So this one example for the inhibit metabolism with the erythromycin. This medication primarily eliminated through the bile and through the liver. It's not through the urine, so remember that. So macrolide eliminated through the bile as active form in the bile and the liver. Moving to the azithromycin. So this one here, first medication. If you click on this medication here, they give you details about the medication. Okay, I will bring this medication here for the discussion here if you like more discussion. For azithromycin, we have 26 pages about erythromycin here. If you can read the information, how this medication works, clinical pharmacology, indication. So you can see the list of bacteria covered by erythromycin. We have Listeria, Staphylococcus, Streptococcus. We have Legionella, Neisseria, Chlamydia, Entomobia, Histolytica, Mycoplasma. A lot of medication there. Okay. Moving to the next, as you will discuss that, we have azithromycin, brand name Zithromax. This medication considered like effective medication against the respiratory infection. Effective medication against the respiratory infections due to the Haemophilus influenza and Moraxella catarrhales. So, which of these which of these macrolide consider effective medication against the respiratory infection caused by Haemophilus influenza? The answer will be Zithromax azithromycin. So, when you have patients from respiratory chest infection by the Haemophilus influenza, the drug of choice will be azithromycin, Zithromax. We can use it for patients from urethritis due to the chlamydia trachomatis. We can use it for Mycobacterium ovum intracellular complex patient with AIDS. We can use azithromycin for Toxoplasma gondii. We can use this medication for the broad range of treatment, especially for the respiratory infection. This medication mainly excreted through the bile and active form. So this one is similar to the erythromycin. Azithromycin mainly eliminated or like excreted an active form in the bile. Okay, the last one here, because we have three popular medication: erythromycin, azithromycin, clarithromycin. Clarithromycin, if another important medication, if you look somewhere here, remember Helicobacter pylori. We can use it during treatment of peptic ulcer disease. We can use clarithromycin for patients from leprosy. It's very old and like it's not popular in a clinical practice now, but Helicobacter peptic ulcer disease, a very popular case in the clinical practice. We use the erythromycin for patients from respiratory infection due to the Haemophilus influenza. We use it for the Legionella, Chlamydia, Uroplasma species. This one causes the UTI. The clarithromycin effective against the Toxoplasma gondii. This one maybe share the same effect. So azithromycin, clarithromycin, we use it for Toxoplasma gondii. Okay, they said this medication you eliminated mainly through the kidneys, through the renal. Okay, eliminated in both kidneys and liver. This medication eliminated through the kidney and liver. Dose adjustment recommended for patient with renal dysfunction. So if you go to the erythromycin and azithromycin, mainly eliminated through the bile. And here we think, do you need to adjust the dose in patients with renal failure? Depends on situation. Normally no, but if the patient on clarithromycin, we need to adjust the dose. So if the patient takes the erythromycin and he suffers from renal impairment, so we need to adjust the dose. For erythromycin, azithromycin, and with renal impairment, because this medication mainly eliminated through the bile, no need to adjust the dose. Okay, another one is erythromycin. Erythromycin is like considered like erythromycin derivative, inhibit metabolism of several drugs similar to the erythromycin. This table here summarizes information about macrolide, erythromycin, azithromycin, clarithromycin. As you can see, all of these medications treat the respiratory tract infection. All these medication treat respiratory tract infections. For example, the erythromycin treat the patients from pneumonia due to the penicillin allergic patients. So this is the alternative. We need to remember that erythromycin could be used to treat gastroparesis. It's already covered in the GI system, pharmacology, clinical pharmacology. Azithromycin, we use it for the treatment of sexual transmitted disease due to the chlamydia, for example. Clarithromycin, we use it for Helicobacter pylori in patients with a peptic ulcer disease. So all these here, they show you us some maybe modification. For example, if you look on the erythromycin, erythromycin is similar to the spectrum here, similar to the penicillin G. Covers Streptococcus pneumonia, Streptococcus pyogenes, and the Staphylococcus, excluded MRSA or MRSA. Erythromycin effective treatment for Neisseria species. Some typical pathogens will be affected. Azithromycin, when you move to the azithromycin, azithromycin considered like effective treatment against the gram-negative bacteria, especially the Haemophilus influenzae. The clarithromycin effective again in Neisseria. So we have a list of a group we can approach the using macrolide in the clinical practice. A comparative study according to the properties of the macrolide Oral absorption, good oral absorption for all erythromycin, clarithromycin, azithromycin, clarithromycin, all these macrolide present the good oral absorption. Half-life, you can see the half-life for azithromycin, single dose daily. No need to prescribe more than one dose. Here we need 4 doses, for example, or 3 doses of erythromycin. Adverse effect. We need to take into consideration patient may suffer from epigastric distress, better tolerated with others. So erythromycin, the most popular medication, may cause epigastric abdominal pain. Cholestatic jaundice, especially with erythromycin. Ototoxicity, especially with the erythromycin QT interval. This is important for all macrolide. So the patient may suffer from epigastric abdominal pain, cholestatic jaundice, ototoxicity. Here we remember, when we talk about ototoxicity, remember we have aminoglycoside may cause toxicity. Is very important to not use this medication, and patient take the aminoglycoside. Don't combine aminoglycoside with macrolide due to the risk of ototoxicity. This will conclude our session about macrolide. We cover the category of macrolide, the broad spectrum of macrolide, side effect of macrolide, and at the end, thank you for your watching and have a great day, everyone.